This is a day that we have been waiting for more than a year. In the city of Detroit, we have lost more than 2,200 of our neighbors. And it's been a terribly painful process. But if you rewind to March or April of last year, we were losing 50 a day. And you remember the governor opened up the TCF Center with more than 1,000 beds in it. There was a projection that the tragedy could have been far greater. In this city, the people of Detroit committed to the testing, committed to the social distancing. But throughout this process, we have had great leadership from Gretchen Whitmer. And it hasn't always been easy. There was one week where they were marching on her for not starting high school sports, and then they were beating up on her for having loosened things up too quickly. And I thought, this is a tough job, because no matter what you do, you get second guessed. But what we saw was a calm, thoughtful, steady response. And I have to take some credit, since she stole the city health director, Dr. Jonae Caldoun, just in time to lead that effort. But now we're reopened. People can begin to re-engage, and we're going to have to still be vigilant. We got more people that need to be vaccinated, and make no mistake. This fall, this Delta variant, we're going to see this come back up again. It's going to happen if we don't get vaccinated. So none of us are slowing down on the efforts. Please keep talking to your friends and relatives that haven't been vaccinated yet. I haven't met a single person, and I've talked to lots of people that are getting vaccinated. I haven't had a single one that didn't call me afterwards and said, thank you so much for convincing me to do that. The stress that's out of your life, the ability to see your loved ones and not worry, makes all the difference. And so I'm really pleased. This was a place where Rochelle Riley hosted, I think, the country's single finest memorial to the people we lost during COVID. And now this island is a place of celebration that says life is coming back to normal. And with that, I want to introduce a resident of the city of Detroit and our partner from beginning to end, Lieutenant Governor Garland Gilchrist.
All right, thank you, Mr. Mayor, and welcome everybody to Belle Isle State Park in Detroit. I'm really proud. See, I didn't realize we were going to do this press conference from literally right here, because about 8 days ago, I was flying kites with my children right here at that picnic table. So this is a really great place to come and to mark progress and to celebrate the state of Michigan moving forward. I want to thank Mayor Duggan for hosting us today. I want to thank Dr. Jonae Caldoun for her just fearless and forthright leadership during this pandemic. And we have some great folks here. Yeah, please. I'm gonna brag on her some more later, so just give me a minute. But I also want to acknowledge the fact that we have some folks joining us today. We have Tanisha, and we also have Tiffany from Delicious Dog 313. This is about how we can fully re-engage people in the types of activities that we miss, including getting hot dogs from food trucks. So everybody please go and celebrate that. And certainly Governor Gretchen Whitmer, who, as the mayor alluded to, has really been a steady voice of reason, perspective, decisiveness, and care during this pandemic. I want to thank all of you. We have so many friends here today for joining us at Belle Isle. We are here to salute how resilient the people of Michigan are and how resilient we've been for the last year and a half. This marks a turning of the page on this pandemic, and doing so on our own terms. But the journey to get here was not easy. It's been a very difficult and challenging one. At the start of the pandemic, the city of Detroit was one of the epicenters for the depths of despair, cases, and deaths from COVID-19. And as a Detroiter, I felt this personally. I've said goodbye to 27 people from this deadly virus. This virus hit our city hard, but we showed that we're harder, that we're tougher in Detroit and in Michigan, that we bounced back and we came together to combat COVID-19. Yes, this virus changed every aspect of everything for a year and a half. We weren't able to celebrate birthday parties or weddings or family barbecues, go to church together in the same way. But despite those missed opportunities, despite those changed plans, we've seen the brightest lights shine through the steadfast commitment that we all have shown to just taking care of one another, the determined resolve of our neighbors to be there in these trying times. And so while today we stand before you hopeful and optimistic, we must not forget those to whom we said goodbye. We must build upon their legacies. Today we start to build that bright future in the name of those people. And as we look to it, we will honor our sisters, our brothers, our neighbors through the culture that we create, through the inventions that we imagine, the businesses that we build, and the love that we share. So as I reflect on these past 18 months further, I think about the medical experts at every level and our health professionals who are on the literal front lines. I think about the bus drivers who transported people to their jobs, the utility workers who kept the lights on, the internet working and connected. I think about the employees who stocked shelves at grocery stores and drugstores. I think about the educators who transformed from in-person learning to virtual instruction literally overnight. When COVID-19 began, we didn't have a roadmap. We didn't have a playbook. We didn't have a script about how to handle this situation. We had to make difficult decisions, but we were guided by facts, evidence, science, data, and it saved lives. We supported families and small businesses. We stood by our first responders and the people who never stopped going to work every day. Our focus has always remained on protecting public health and public safety for every person who lives and works in Michigan, because our people are our everything. We would not be standing here today on Belle Isle without Michiganders from all walks of life stepping up, standing tall, and doing their parts. So while Michiganders adapted, we pulled together, we showed just how resilient we could be, and I'll forever be inspired by the kindness and determination that so many people shared through these stressful times. Millions have literally rolled up their sleeves to get the COVID-19 vaccine. It's been even more safe and more effective than we first thought. And that has enabled us to make the changes that launched today ahead of schedule. The words public health have a new meaning today as we move toward our new normal. Members of the general public actually understand what that means now when they're paired together in the way that we didn't before. Public health officials, including Dr. Khaldun, are some of the most watched and listened to people and respected folks in American life, and they should be. COVID-19 has given more clarity to just how important public health is. It binds us together amongst our collective well-being. And as we studied and learned about the impact of COVID-19 on public health, we saw the disproportionate havoc that it had on communities of color. And as the chair, being appointed that chair by Governor Whitmer to the Michigan Coronavirus Task Force on Racial Disparities, I'm proud of the leadership role and the progress that Michigan has made toward eliminating COVID-19's disproportionate impact on Black Detroiters and other Michiganders of color. But that work is both fragile and unfinished. We've come a long way, but there are still many Michiganders living in the wake of centuries of racial injustice that have led to these health disparities. That is why Governor Whitmer and I remain committed to reducing racial disparities of all kinds: economic, educational, health, and social. I want to close with the words of Macy Jamison. She was the first Black woman to go to space. And she once said that the best way to make dreams come true is to wake up. Well, the sun is rising as the darkness of this pandemic recedes and gives us a bright, beautiful day like today. It is time for all of us to both wake up and rise up and move forward toward the prosperity that is possible as we again unlock the full economic potential of the people of Michigan. So now, before I turn the podium over to Dr. Joné Khaldun, I want to thank you. I want to thank you for your example. The people of Michigan and I are so grateful for your leadership, your expertise, your tenacity, your knowledge, your professional experience and compassion. It has been invaluable to our state and frankly a beacon to our nation, as she is now part of the COVID Equity Task Force appointed by President Joe Biden and Vice President Kamala Harris. There's no wonder why they asked you to be in this leadership role. Just thank you for everything that you have done, that you're going to continue to do for the state of Michigan. We could not have done this without you. And so with that, I turn the podium now over to the Michigan State Chief Medical Executive, Dr. Jonae Caldoun.
Wow, thank you. Thank you so much. Good afternoon. I'm just so humbled and so excited to be here today on such a very just glorious occasion of releasing the epidemic orders. And I, of course, have to thank Mayor Duggan for bringing me back home over 5 years ago. I had no idea what I was signing up for, but thank you for bringing me back home from the East Coast. And of course, to the Lieutenant Governor and the Governor, thank you for asking me to come up to Lansing and for believing in me. I truly, really appreciate it. Thank you. And also, I'd say for all of your bold leadership throughout this pandemic. So the past 15 months of fighting this pandemic has been grueling and something that I certainly never imagined that I would be doing, and I think none of us could have ever imagined we would have to experience. Over 893,000 Michiganders have been infected by this terrible virus, and over 19,000 Michiganders have lost their lives. And unfortunately, the virus has not spared anyone of any age, and as the Lieutenant Governor mentioned, it has absolutely devastated communities of color. But because of the work of all of us, of people all across the state, we are now at the lowest case rate that we have seen since this pandemic started. Under 18 cases, yes, under 18 cases per million people. Our percent positivity is under 2%. And we've seen over about 9 million doses of the safe and effective vaccines in arms across the state, and that is cause for celebration. So there are so many entities and individuals who have contributed to this incredible progress. I know I'm going to miss some folks, but I thought I'd just take a moment. I want to especially thank the staff at MDHHS. They have worked diligently throughout the entire pandemic. Some of them have not had a single weekend off until last week, actually. They've worked to track and report cases, respond to outbreaks, support our local businesses and our schools and our local health departments, and they've been working to implement policies that assure access to food, healthcare, and social supports. And I also want to really take a moment to thank our state epidemiologists. I think this pandemic has showed us how important epidemiology is and how important epidemiologists are. So Dr. Sarah Lyon-Callow is our state epidemiologist, and without her, I and this state certainly would not be where we are today. So I absolutely want to thank her. I also want to thank our frontline healthcare workers. I've had the honor of also continuing to work in the emergency department at Henry Ford Hospital throughout this pandemic. I can tell you our frontline healthcare workers, our staff, our nurses, our doctors, our techs, they have just been amazing and incredible, sometimes even risking their own lives, so risking themselves getting infected and their families, but they still showed up every day to take care of patients, and it's been just an honor to work alongside them. And finally, thank you to our local health departments, who are the boots on the ground public health leaders across the state who are really working to fight this pandemic. And all of you have Denise Fair in the city of Detroit. Yes, she has just been incredible. I was just so honored to pass the baton to her, the Detroit Health Department, and she has helped save so many lives here in the city. So thank you for your leadership. So I always say that the work of the public health department is not just about the work of public health. It's not just about the work of the health department. So people across the entire community have stepped up. Many of you, businesses, hospitals, school districts, community-based organizations, and just everyday people. You've done what it takes to protect yourself and each other. So whether it was social distancing, making sure you were washing your hands, wearing your mask, isolating, and getting a vaccine when it was your turn, Michiganders have shown up, you have shown grit, and that is why we are able to stand here today and rescind our broad epidemic orders. So I'm pleased with how far we've come, but as the mayor mentioned, our work is not over. And while our cases and our test positivity rate are low, the pandemic has not ended. There are still many people who have not been vaccinated, and we have not yet achieved herd immunity. And we still have the more easily transmitted variants across the United States and here in Michigan. We've identified the new Delta variant here in the state, and this variant is even more easily transmitted than the Alpha variant and potentially causes even more severe disease and may not be susceptible to monoclonal antibodies, a treatment for people when they get COVID-19. So the single most important thing we can all do right now to fight back these variants is to get vaccinated. MDHHS and our local health departments, I know Director Fair, we're still working very hard with our partners across the state to make sure vaccines are accessible for everyone in every community, whether that's in a doctor's office, at a church, or even in your home, if that is what is necessary. So if you are not yet vaccinated, you should still exercise a little bit of caution. So social distancing, wearing a mask, especially in indoor public spaces, quarantining and getting a test if you've been around someone who has COVID-19. And please, please do get your vaccine as soon as you can and do not delay any longer. And for those of you who are vaccinated, your risk of getting the virus is very low. And I'm so pleased to see all of us here, many of us without masks on, because we are confident, we are comfortable, because we're outside and we're vaccinated and we are protected. So I ask that all of you who are vaccinated, please continue to tell your story. Talk to your friends and family members about your experience and your why for why you got the vaccine. So we've come so far, and I'm just so proud and so pleased to be here. The worst of the pandemic is absolutely behind us. So let's keep up our trajectory, let's get more shots in arms, and let's end this pandemic once and for all, and absolutely get everyone back to normal. So thank you. With that, I will turn it over to Tiffany Barber.
Thank you so much, Doctor, and I want to thank everyone for being here today. Thank you to our valiant leader, Governor Gretchen Whitmer, and our Lieutenant Governor for all of her work. My name is Tiffany Barber, and I am a small business owner here in the city of Detroit. I was one of the oldest vendors with the city of Detroit for 15 years, having a hot dog cart in downtown Detroit, amongst other businesses. And with COVID-19 and Corona, it really ravaged and devastated my business. We had to shut down at our location due to so many closings and just safety risk. And with that being said, the state of Michigan came in handy by providing grants for us for not only PPE, but also training that allowed me to change my business model from an everyday model to an event-only model and keep my employees safe, who I've had for years, and continue to employ young college students and young women and allow them to still have income in their life. We are so thankful to our state for providing that guidance to us and allowing us to be safe. Of course, our business took a hit like so many other small businesses, because I am the true definition of a small business owner with a few employees, but we were able to stay alive. We were able to stay around. We were able to stay open, and we are so thankful to the guidance of our state and of our leader for allowing us to have that. I just want to close by saying we don't have to stay where we start, like my shirt says. Just because at one point in time we're in a bad place, that doesn't mean we'll always stay there. And if we continue to do efforts like we're doing today, we will get through this together. Remember, even though a lot of us was isolated at home, that doesn't mean that we were alone. We were still in this together. And I want us all to take that understanding that together, even when separated, is better. Make sure you always stay hopeful, follow your guidance, and I am thankful for all of the resources that my state was able to provide to keep my businesses open, to keep me thriving, and to just keep us all going. So I thank you all for having me at this press conference today. Thank you for hiring my business, Tiffany's Delicious Dogs. And I just want to say to all the small business owners, trust me, it's not over. Just keep going. We're going to get through this together.
Hello, everybody. Allow me to introduce myself. My name is Tanisha Nesbitt. I'm a Wayne County Community College District student, Phi Theta Kappa member, and thanks to our wonderful governor, a Michigan Reconnect recipient. As a single-parent mother whose daughter was born with multiple medical needs, I can't begin to express how deeply grateful I am for the bridge over, as I put it, troubled waters that I was facing. Without the Michigan Reconnect program, I would not be able to have this bridge and opportunity to continue pursuing my educational endeavors of becoming a nurse and a friend to the sick. I can only tell you that as a single-parent mother, every nickel and dime matters. Every opportunity counts. And thanks to our governor with her unwavering convictions about the pandemic and about giving individuals like myself opportunities, I don't know what I would do. I don't know where my daughter and I would be. And so without further ado, I would like to introduce our governor of the state of Michigan, Miss Gretchen Whitmer.
That was great. You didn't even need any notes. All right. Well, thank you. Tanisha was wonderful. She came up with notes and she never even looked down. So I'm glad to be here with all of you. Mayor Duggan, who's been such a great partner and such phenomenal leadership here in the city. Dr. J, who I stole from you, but I'm so glad. Guiding the work that we did every minute. She's the person I spent maybe the most time with. But obviously my partner, the Lieutenant Governor, is right up there, maybe 1 and 2. They're vying for how much quality time we've spent together the last year. We are joined by a number of people here today, and today is an exciting, happy, joyful moment. This is an exciting announcement that we are now dropping the EPI orders. Effective today, there is no more mask or gathering order. Effective today, there are no more capacity limits, indoors or outdoors. Effective today, our Pure Michigan summer is back and we can realize it. So we wanted to come to beautiful Belle Isle to acknowledge this momentous moment, to celebrate how far we've come, to honor those who we lost in this tough, awfully hard year for all of us, but to be here together and to be joyful, mask-free, and to be able to greet one another in ways that we couldn't over the past year. Now, I know we've started so many conversations with, how are you coping or how are you holding up in these unprecedented times, right? And there's a reason. It's been a grueling 15 months. I think Dr. J used the word grueling. That is the perfect word. We've all been pushed to our breaking points, physically or emotionally, mentally. Many of us have lost loved ones. I'm still thinking about so many friends that I lost over this last 15 months, and we're tired. Just exhausted. And yet, this pandemic was relentless and exposed and exacerbated so many underlying challenges that were there before the pandemic and will continue to be there after the pandemic. So it centers the work that we've got to do. But we're also inspired by incredible acts of heroism and grace and kindness that we saw. Communities coming together, people delivering food for relatives or neighbors who were homebound. It was thousands of essential workers that stayed on the front line. And it's really exceptional and worthy of our gratitude and acknowledgement. But we've got to do more than just thank our essential workers, right? Last year we created the Futures for Frontliners. This is a program that is an opportunity for skills for people who did stay on the front line, those who stocked our grocery shelves, as Lieutenant Governor mentioned, or who kept us home and our lights on when we all had to stay home. It's a program that's the first of the kind in America, and I'm hoping other states will copy us. I know lots of governors steal each other's good ideas and never give one another credit, but I'd be happy if others stole this idea. Because this is replicated from the after World War II, when we were able to pay for college and skills opportunities for those who served our nation. That's what this is about. 85,000 Michiganders have been accepted, and over 15,000 are already currently enrolled in classes. Our Futures for Frontliners, which Tanisha so beautifully spoke about, is an important ability for people who are 25 and up to get enhanced skills so they can get into good paying jobs. And today I'm proposing that we use $100 million, which is a fraction of the billions that the Biden administration has sent to Michigan, to fully fund Futures for Frontliners. So this infusion of resources would fully fund 2 years of college for the over 15,000 recipients who are already in taking classes. And it would allow us to expand the program to cover those who were unemployed because of the COVID surge this winter. And this is what we've laid out in my budget. Every day throughout this pandemic, our frontline heroes woke up, they put on their masks, they got to work on behalf of their fellow Michiganders. They saved and contributed to the saving of countless lives in our state. And so it's not just gratitude, but it's opportunity that we want to create for them. Additionally, I want to once again acknowledge and lend my strong support for hero pay for our essential workers as well. With the billions in federal funding coming to Michigan, a one-time disbursement of hero pay would honor essential workers who selflessly stayed and put themselves at risk to take care of others. I was with SEIU at Mission Point last week talking with nursing care workers who have done so much to support our elderly population. But this is also about teachers and truck drivers and custodians and carpenters and correction officers and nurses and grocery store employees. This one-time hero pay would go a long way toward acknowledging the incredible sacrifice that they made on all of our behalf. I appreciate Rochelle leading the clapping. Thank you, Rochelle. As we look ahead, we've got a lot to look forward to just beyond a beautiful summer, right? We've got an unprecedented opportunity to use this $3.5 billion surplus, all right? 12 months ago, we thought we were going to have a $3 billion deficit. We now have a $3.5 billion surplus. This is an opportunity where we can make transformational change. So I want to lay out a couple of things that we're doing to help us emerge from this pandemic stronger than ever. There are broad economic issues that we face as we continue our comeback. We need jobs that pay higher wages to attract applicants. Small businesses need capital to ramp up hiring and boost investment in their internal operations. And childcare is plainly out of reach for too many Michiganders. So to address these changes, we've introduced the Economic Jumpstart Plan. This is a plan to boost wages to at least $15 an hour by giving businesses grants to cover the difference between the wage they pay and $15 for the next 3 months. This is an investment of $1.4 billion in addition in childcare. So to boost this industry so that we can pay providers and childcare professionals more, make 150,000 more kids in our state eligible for no cost or low cost childcare, and give all student parents, give all student parents enrolled in Reconnect or Futures for Frontliners access to free or reduced cost childcare. And for small businesses, we're making available grants up to $20,000 for rent, taxes, payroll, mortgage, or operating expenses. To further support small businesses, we've announced the Back to Work incentive. Now, under this new incentive, eligible laid-off employees can earn $300 per week in addition to their salary. So not have to choose, but to earn it in addition. This is an incentive to draw down this federal dollars and use it for people who get back into the workforce. We should expand this so that it's not just people returning to the job they had pre-pandemic, but getting into any job. We need the legislature to help us on that front. So since it's 100% federally financed through September 4th, there's zero impact on the employer or on the state budget. So businesses are able to hire new employees and returning employees. But we need the legislature to change statutes so that we can expand this for everyone. And we can utilize our surplus and federal dollars to make schools safer and help all students reach their potential. There's no question we've got a lot of work to do to meet the needs of our students. This has been a disruption unlike anything we could have imagined. And so, providing districts with hundreds of millions of dollars to address the hiring needs, retain more educators, psychologists, social workers, counselors, and nurses. We want to invest in a weighted foundation formula that acknowledges we've got to reach for equity here, not equality, but equity, and make a one-time capital investment of $500 million to build up school infrastructure. Now, critically, we are in a position to do what Proposal 8 imagined almost 30 years ago and close the per pupil funding gap in Michigan. Now is the time to do it. So these are the kinds of investments that we can make to grow our economy and come back stronger than ever. I think we all know that economic recoveries take time, but I think we all know we've got the wind at our back and we don't have time to waste. So these resources will help propel us forward. We got a big task ahead of us, but we are up to this task because we know Michigan might get knocked down like everyone else, but we dust ourselves off and we help one another get back up. Thanks to the sacrifices and the efforts of so many people, today we can have a collective sense of optimism. We can breathe safely and knowing that we can hug and love our friends and relatives, and this is a wonderful moment. So I'm excited about this. Take a moment to envision the quintessential summer ahead. Do you see yourself sitting on the shores of a Great Lake or hanging out on Belle Isle, eating a cone of Superman or Mackinac Island fudge? Yeah? I know you all know ice cream, right? All right. Perhaps you're crossing a bridge and heading up north. Maybe you're going camping or shopping locally, getting out and about. We've got the ability to do all these things, and I'm excited about that. And the reason we can move forward so confidently is because so many people in this state took this seriously, did their part. We've got more vaccinations to do, there's no question, and we're going to continue working on that front. We want to educate and answer questions of people who haven't gotten vaccinated yet. We need to give a little grace when we see someone who hasn't yet but has questions. Let's wrap our arms around them. Let's keep them safe, but also let's work to make sure that we get them vaccinated. Because right now we do know that the Delta variant is real and we got to take it seriously. But let's take this moment and celebrate the end of the epidemic orders, the opening of a pure Michigan summer, and the opportunity that lies ahead as we gin this economy back up. So thank you all for doing your part. Thank you for being parts of the solution and supporting one another, and thanks for being here.
Madam Governor, if the essential to get to the black community is important, why are we not using the black paper for the advertising regarding the vaccination and other things? And I know I've tried my best with the smiling faces in your office, but it hasn't worked.
So we've done a lot. You know, we saw very early on, thanks to Dr. J's leadership, and I think that's why it's so important that we have real representation in government, empowered representation. Dr. J was one of the first medical executives in the country to see the disparate impact that COVID was having on communities of color. We jumped into action. We created the task force on racial disparities. We did outreach. We saved thousands of lives, not just here in Michigan, but other states learned from us. So we've done a lot of outreach in the community. I know you've got a specific question because it's personal.
I was with 20 black Michigan people yesterday from the press, and none of them have got ads from you or the doctor, let alone me not getting none from the city. But you see them in other papers that you talking about black people, but you won't talk to the black people about black people. The black press, I should say. I
think let's continue this conversation. I appreciate where you're coming from. I see and recognize the value in talking right to the people who we're trying to persuade and support. And so that's a conversation I think we should continue after the press conference.
We have just a few minutes for questions on the re-engagements or the jumpstart.
As you're talking about lifting these restrictions, there's also efforts to take away your ability to have restrictions in the future. And we're hearing that they're holding that hostage as they're negotiating the budget. What is your message about the ability to have these restrictions implemented by the governor's office or the health department? And what are the risks with us not at herd immunity yet?
So you've asked two big questions. I'll just start with this. We have serious needs across the state, and the federal government has sent us billions of dollars. We need the legislature to appropriate those dollars so they can get to the people that need it, whether it is people who need access to health care, or it is students who need support as they get back into school, or it is businesses that were left out of other programs and they need a little help to survive. That's what these dollars are for. And the legislature has not yet appropriated them. We need to get this budget done, and we need to get these federal dollars deployed. Other states are moving faster, and that's precisely why it's important that they can't hold this hostage, because the people of our state need help now. Now, I've told the legislature I'm willing to have all sorts of conversations about improvements we can make to epidemic orders in the future. It'll probably never, ever, never have to be used again under my watch. And I hope no governor in the short term will ever have to even visit these powers. But if they do, they're going to need to act swiftly to save lives just as we did. And that's why I'm going to make sure that governors going forward will have the ability to take action to save people's lives. It will be a Republican governor in the future. There will be a Democratic governor in the future. Every governor before me had these abilities to take action if they needed to. Everyone after me should as well, because the people of Michigan need their chief executive to act when their lives are on the line.
Senate Majority Leader Shirkey, during a television interview over the weekend, suggested that he didn't see the logic in your administration encouraging people to go back to work and giving them an extra, giving them $300 to help them along. How do you speak to critics who don't see the economic logic in that point of view, in that position?
So I'll speak to the general public on this one. People have been laid off. They have had to leave their workplace to take care of kids who are out of school. People have been through an incredible amount of stress. Our federal government came to our aid by sending unemployed people a little extra help so they could keep a roof over their head, keep their water on, put food on the table. This help has been a lifesaver for so many people across our country. Michigan is not unique on that. But the fact of the matter is, so long as we've got lack of access to childcare, that's a complete barrier for people getting back to work. So long as people are worried about their health and safety, they're going to have a lot of misgivings about getting back into work. So what we wanted to do was not to say we're going to penalize you for going back to work, but we're going to support you. And you can still draw down this $300, and you can use it as an incentive in addition to your paycheck. Now, it's about $1 billion a month that's coming into Michigan. This money goes right into our economy, right into small businesses, right into paying rent and the foundational things that people need. And so to wage the kind of class warfare that some want to and penalize people who are on the fringes struggling to get by, I think is the wrong thing, and it hurts too many people. And that's why we want to use these resources as incentive to bolster a paycheck. If you jump back into the workforce, you won't be penalized for it. In fact, you'll be rewarded for it, and you can draw down that $300 a week.
Governor, now we've been hearing prefaced that the pandemic is not over. We have the variant, Delta variant. In the fall, things could go up. Do you feel that our vaccination numbers so far will protect Michigan from having to go back into epidemic orders of any sort?
Well, I'm pleased with our vaccination numbers. Certainly, I would like to see us get to 70% as quickly as possible. We're doing a lot of work to meet people where they are, working to get right into neighborhoods, partnering with churches, for instance. I mean, there's a lot of work on that front that is happening. There's no question that this Delta variant is real. That's what viruses do, right? They mutate, they change, they morph. And at this point, these vaccines are still the best tool that we have to stay safe. And that's why we've got to encourage people to get vaccinated. Now, our legislature has not embraced this. I'm grateful for people like Stephanie Chang, our senator who is here, Senator Bullock who is here as well. I know we've got Representative Tanadar and Representative Carter was here as well. I'm grateful for their leadership. But the majority in our legislature, the Republican leadership, has not done a lot to help our efforts to get people vaccinated. And that's one of the things that we're working to overcome. We also want to make sure people get their questions answered. And this is work that takes a lot of time and energy, and it would be great if the legislature would come together and support our efforts and do their part to encourage people to get vaccinated.
Governor, at the current rate of vaccination, when would we expect to reach 70%?
Okay, I'm glad Dr. J's here. You want to try that one, Dr. J?
get the easy one.
Yeah, I mean, I don't have a crystal ball. We fully recognize, as expected, that our demand for the vaccines has decreased and we now have more supply than demand. But I'm confident that we will eventually get to 70% of Michiganders 16 and up. I can't give you an exact date, but I'll tell you we are working very hard, as I said earlier. Every pediatrician office, every primary care doctor's office. We're even vaccinating people. I vaccinated some people in the emergency department even. So we are doing everything we can to get out into neighborhoods and make these vaccines as accessible as possible.
Where are we today, please?
We're at about 61% of people aged 16 and up who are have gotten one dose.
We can take 2 more questions.
Governor, you've gone across the state sort of painting a vision of the economic restart. There hasn't been much public engagement from the Republicans in the legislature on that. Is that making any headway privately, or is it potentially hindering your chances? I know they've sort of felt left out of many of your announcements over the last year or so.
Well, Emily, I can invite people to the table, but I can't force them to pull the seat out and sit down. So I continue to invite the legislature. When we talk about the Michigan economy, this isn't about Democrats, this isn't about Republicans, this is about small businesses, this is about people who are trying to take care of their families. This is about making sure that Michigan comes out of this pandemic in the strongest possible shape. We have to work together to make that so. I have put out some plans to show we can do this. I've worked with the business community to craft these plans. I invite the Republican legislature to be a partner here. I will continue to do that. No matter how poorly they treat me on occasion, I will smile and turn the other cheek because Michigan's economy is more important than any one person's ego in the city of Lansing.
Last question.
Why did you take us through your thought process? Why did you feel confident to open up the state a week early when we aren't yet at that threshold and we do have the Delta variant?
So one of the words that we all have lived by over the last 15 months is nimble, right? We are watching the data, we are listening to the experts, we are pivoting when necessary. When the CDC changed their mask guidance, we had to move quickly. It was kind of a surprise, not necessarily a welcome one from some of our perspectives, but they did, and we were nimble. At this point in time, our COVID numbers have plummeted, hospitalizations have. Our vaccination rates continue to climb, albeit a little slower than I'd like to see, but they're continuing to move in the right direction. And because of all these things, we felt comfortable moving forward today. But as always, it is always in consultation with Dr. J, Dr. Sarah Lyon-Callow, and our public health experts across the state. All right. Thanks, everybody.